Hello friends, welcome back to my channel Only Bio. Presenting up the series that is Do You Know, the 22nd one. Today we are going to talk about the lion's defense for kidney stones. The kidneys are our body's blood purification plant. They throw out the unwanted waste products and toxins, retaining the essential substances. When blood coming to the kidney for filtration contains too much of any substance, it crystallizes in the urine, forming sediment and sludge, which can eventually end up as stones. Who is vulnerable to kidney stones? Heredity as well as environment play their role. Men are more vulnerable thrice as much as the women, commonly occurring between the ages of 30 and 50 years. These calculi is nothing but the medical term for kidney stones, are likely to occur in dry, hot climates where dehydration is common. People consuming hard water and those who overexert and fail to replace the fluid lost in perspiration are vulnerable. Also, people who are physically inactive and those having gout, parathyroid, and thyroid gland disease, and in certain types of cancer. Stones may be single or multiple and vary enormously in size, from sand like minute particles to large stones of up to 6 to 7 centimeters. The stones may be located anywhere in the kidneys or the urine collecting and transport system. Pressure and damage due to obstruction leads to a condition called as hydronephrosis. There is stagnation of urine and this may lead to infection causing further damage to the kidneys. Most people with kidney stones do not have any complaints. However, if a small stone enters the ureter, it causes a severe pain starting from the back and shooting down one side of the abdomen to the genitals. This is one of the most severe pains known. The patient becomes restless, assuming different kinds of postures. There may be paleness and associated sweating and vomiting. There may be passage of blood in the urine. If left untreated, this pain of ureteric colic subsides after a few hours when the stone moves to a different location. If the stone is less than 0.5 centimeter in diameter, it may be thrown out with the urine. For some people, it can take months of patience and pain to pass a stone out. You need to see a doctor if you experience intense pain or pass blood in the urine. If you pass a stone, it should be taken to the laboratory analysis as chances are that you may be getting another. An X-ray and ultrasonography of the abdomen reveals the size and the site of the stones. Large stones can create significant blockages, giving pain and infection, damaging the kidneys. Doctors today have a number of strategies for ridding you of a kidney stone. What doctors can't always do is a guarantee that you won't get another. To prevent the recurrence, you should be aware of the types of kidney stones. So here we get an idea about the type of the stone and approximate frequency of occurrence. First is calcium oxalate. Almost 65% of the kidney stones are of calcium oxalate, 15% of that of calcium phosphate, magnesium ammonium phosphate, say almost 10 to 15%, uric acid kidney stone is 3 to 5%, and cysteine is 1 to 2%. Regardless of what kind of stone you have, by far the single most important preventive measure is to increase the water consumption. Water dilutes the urine and helps to prevent high concentration of those salts and minerals that clump together to form stones. The aim is to produce a daily urine volume of 2 to 2.5 liters. That means you have to consume far more than that to account for water loss during perspiration and breathing. A large glass of water should be drunk before going to bed at night and on waking during the night if it occurs. Of all the stones we see, 92% are made of calcium and its products. If you are taking supplements, check their calcium content. Certain popular antacids are enormously high in calcium. Limit the calcium rich foods in your diet, such as milk, cheese, butter, etc. Don't eat too many oxalate foods. About 60% of stones have oxalate. If you have had an oxalate stone, then you should restrict your consumption of oxalate rich foods, which includes beans, beet, chocolate, grapes, green chilies, spinach, strawberries, tea, coffee, colas, and beer. Eat vitamin A rich food. Vitamin A is necessary to keep the lining of the urinary tract in shape and help discourage the formation of future stones, irrespective of the type of the stone. Foods rich in vitamin A are carrots, apricots, mangoes, pumpkins, and sweet potatoes. Watch your protein intake. There's a direct correlation between the incidence of kidney stone disease and the amount of protein eaten. Protein tends to increase the presence of uric acid, calcium, and phosphorus in the urine. If you had uric acidosis, stones, cut down your meat, fish, poultry, and cheese. Limit your salt intake to 2 grams per day as it results in calcium and fluid retention in the body. Don't take excess vitamin C and D. Large amount of vitamin C, that is more than 3 to 4 grams a day, can increase the oxalate production and thus risk of kidney stones. However, this is most unlikely that you could consume this much of vitamin C in your diet. You would have to need to eat 37 Nagpur oranges a day for this amount of vitamin C. So your concern should be with the supplements. Don't take them. Excessive amount of vitamin D causes increased calcium in all parts of the body. Stay active. People who are inactive tend to accumulate a lot of calcium in the bloodstream. Activity helps to pull calcium back into the bones where it belongs. In other words, if you're prone to calcium stones, don't sit around all day and wait for them to form. Get out, take a walk, fly a kite, ride a bike, be active. Friends, hope you've liked the series. Thank you so much for being with me. Keep sharing with your friends.